Good morning to our visitors, teachers, and fellow students of caregiving. Welcome to our health awareness program. Today we are going to be talking about ambulation and movements of the patient. So we are going to learn how we see it and how to apply it according to all these settings. Before we continue, let me introduce myself. I'm Marisol Mongiho and my group mates, Mata, Chachi, Rowena, Tintin, Helen, and Rowena. Okay. Now, being a caregiver, we are prone in bending our backs, flexing our legs and arms. Because of this, we are at risk for developing physical strain, back injuries, and fractures. A way to prevent these kinds of scenario is to practice proper body mechanics. Proper body mechanics is the way in which we position our bodies during tasks. It involves the coordinated efforts of muscles, bones, and nervous systems to maintain balance, posture, and alignments during moving, transferring, and repositioning of the patient. Proper body mechanics allows individuals to carry out activities without excessive use of energy, fatigue, pain, prevent injuries, damage to muscles and joints for patients and healthcare providers. There are major keys to success. First, boss with balls. Boss with balls is a base of support with base of stability. Balance involves in wide base of support and low center of gravity. When you're standing, separate your feet, makes your base of support broader. Your center of gravity is your torso, which is the heaviest part of your body. This one. Bending your knees, put your center of gravity lower, closer to the base of support. This also takes strength of your back. Second, stability for ability. Not bending the knees, find that it is difficult to move the patient without stability, like this. It's very difficult to move the patient. When bending the knees, it's easy to move the patient. When you bend the knees. Now, third is keep close to the moss. Stay far away from the patient, cannot able to move the patient safely. So, coming close to the patient, when you move the patient, you have to close with your patient, keep close to the patient, and move the patient safely and efficiently. Resist the twist. In order to avoid twist motion, it is important to plan ahead or move the equipment in a safe or efficient manner. That way, the caregiver not hurt and the patient is safe as well. So we have to, example, this one is our equipment. We have to put the equipment in a proper place so that we cannot take the equipment twisting like this. We have to face up equipment and move. And then wash your back to keep your career intact. So next, the topic is about ambulation, discussed by Rowena.
Good morning, everyone. This is all about ambulation. Ambulation is the ability to walk from place to place independently with or without assisted device. Ambulation includes everything from standing and walking to positioning and even transport from medical facilities. First, wash your hands, introduce yourself, lower the bed into the lowest level, assist the patient to sit on the edge of the bed, push and allow patient to sit on the edge of the bed a few moments to regain her balance. Assist the patient in putting on the sock, not skate shoes. Applying a git belt. Stand in a position of good body mechanics. Assist the patient to standing position, strengthening your legs, left or without the git belt, and the patient pushes down with his hand on the mattress. Instruct the patient to position his body within the frame of the walker. Instruct the patient to move the walker forward by lifting it up, moving it forward, and sitting it down. Instruct the patient to take a sit-up forward with a weak leg. Instruct the patient to move his strong leg forward. Instruct the patient to take the short steps and keep his hand and legs looking forward. Walk the patient to stance as indicated in the survey plan. Return the patient to the bed or chair. To ambulate backward, the patient steps forward with his strong foot, takes a step back with his weak foot, and then walker in more back. Have the patient feel for the arm or chair or top of mattress with his hand. Assist the patient into the chair or bed. Make sure the patient is comfortable. Washing hands and record of conversations. Thank you.
How we transfer the patient? Proper transfer need to balance so that we can confidently move our patient when needed. As a moving a patient from one place to surface to another. There are several types of transferring a patient, but we choose only the simple and what is available in our tools. We are first bed to wheelchair, then reverse wheelchair to bed, and then the second a sliding board, wheelchair to sliding board, wheelchair to chair. We're using a sliding board, and then bed to wheelchair. First bed to wheelchair transfer. Patient often need assistance moving from bed to wheelchair. A patient must be cooperative and predictable, able to bear away on both legs and take small steps. Then place the wheelchair at 45 angle to the bed so that the person will be transferring to his stronger side. Then lock the wheelchair and the bed. Then tell the person what are you going to do. Then the fourth, let him rest a while if he feels or she feels dizzy. Then 5, use a belt if the person needs a lot of support. 6, put his shoes while he is still lying down if he or she weight are unstable. Bring him to a sitting position while his legs are over edge of the bed. Let him rest if he feels dizzy. Then help her to standing position. Use transfer belt if the person needs a lot of support. Give him reach for the arms of the chair and pivot your body slowly. Then support him with your arms and knees as needed. Adjust him or her comfortably in the chair. Next is transferring from wheelchair to bed. Reverse position. Then place the chair at 45 angle to the bed. So the person on his stronger side, then lock the 12s. Next, get into a position to provide a good base of support. Use a good body mechanic. Fourth, have the person stand pivot. Then support and guide him as needed. Adjust the position of the person in the bed with pillows. Next is transferring from wheelchair to bed with board. But actually we change, so we use the wheelchair to chair position. With sliding board. Wheelchair. Then, try to adjust the bed and the chair to the same height if possible. Place the wheelchair at 45 angle to the bed so that the person will be transferring to his stronger side. Lock the wheelchair of the chair and bed or use a small block. Tell the person what I'm going to do. Remove the armrest nearest to the bed. Remove his feet from the footrest and swing the footrest out of the way. Have the person lift his head and place standing point. Have the person lift his hip and place the board under the hip with the other end of the board on the bed. Next is bed to stretcher transfer. Position the stretcher next to and parallel the bed. Then lock the wheels on the stretcher and the bed. Remove the pillow from the bed and place it on the stretcher. Then the two nurses should stand on the stretcher side of the bed. Then the third nurse should stand on the side of the bed without the stretcher. Then position and transfer on the other lateral assist device under the patient. Use the draw sheet or roll the patient away from the stretcher. Slide the transfer board across the space between the stretcher and the bed, partially under the patient. Roll the patient into his back so he is partially on the transfer level. Nurse on the side of the bed without the stretcher should kneel on bed with his or her knee at the upper torso, closer to the patient than other knee. Fold or bunch the throw sheet close to the patient before grasping the set. Next, have one or nurse on the stretcher side of the bed reach across the stretcher and grasp the draw sheet on the head and chest area of the patient. If the transfer device used as a long handles, each nurse should grasp two of the handles. Have the other nurse reach across the stretcher and grasp the draw sheet at the patient's waist and the hip area.
Next topic is about the turning of patient on the bed. Turning of patient in the bed is very important for patients that cannot move on their own at all. When patients are in the bed for extended periods of time, this puts pressure on the bony areas of the body. Turning patients at the regular 2 hours intervals helps to prevent the development of bed sores. First is the supine position. The patient lies on her back. Pillows may be used under the head, knees, and calves to raise heels of mattress. It is often used in surgery for abdominal, facial, and extremity procedures. Next is prone position. The patient lies face down. Arms may cushion the head or may be flexed. It is contraindicated after abdominal surgery and in patients with respiration or spinal problem. Next is Fowler's position. This sitting position raises the patient's head 40 to 90 degrees. Pillow can be used under the head and arms, and a footboard may also used. The position improves cardiac output, promotes ventilation, and eases eating, talking, and watching TV. Next position is Sims position. This is a semi-prone position wherein the patient lies on the side with weight distributed toward the anterior ilium, humerus, and clavicle. Sims position. Yes. Semi-Fowler's is a semi-static position wherein the patient's head is elevated 30 to 45 degrees. Knee chest, that one. This position is the knee chest. The patient lies prone with buttocks elevated and knees drawn to the chest to accommodate a rectal procedure for examination. Next is side lying. The patient lies on the side with weight on hip and shoulder. Pillow support and stabilize uppermost leg, arm, head, and back. Yes. Next is the lithotomy position. The patient lies supine with hip flexed and calves and heels parallel to the floor. That requires draping the patient for privacy. It is used for vaginal and rectal examination. Next is the Trendelenburg position. The patient lies supine with head 300 to 400 degrees lower than the feet. The position may be used for postural drainage and to promote venous return. Because our bed is not the adjustable hospital bed, that's why the position is like this. So on the hospital bed, we have to put down the bed base, adjust, and the leg will, the feet will up, and the head is down. Okay, that's all. Next is the fall prevention. Falls are the major priority in healthcare, and healthcare providers are identifying, managing, and eliminating potential hazards to patients. All patients handling activities like positioning, transfers, and ambulation pose a risk to patients and healthcare providers. Older adults may be at increased risk of falls due to impaired mental status, decreased strength, impaired balance and mobility, and decreased sensory perception. Other patients may be at risk due to gait problems, cognitive activity, visual problems, urinary frequency, generalized weakness, and cognitive dysfunctions. Specific treatments and medications may cause hypotension or drowsiness, which increase a patient's risk to fall. The management of the falling patients, the patients who collapse. Assume a broad stance with one foot slightly forward, grasp the patient's body firmly at the waist or under the axilla, and allow her to slide down against your leg. Ease the patient slowly to the floor using your body as an incline. Lower your body along with the patient if necessary, and utilize proper body mechanics. Next, the patient who loses balance. Attempt to stabilize the patient by bracing him against you. Guide the patient to the bedside or chair, if possible, and if a fall begins to occur, guide him slowly toward the floor.
995, can I help? Safety massage to prevent free. Hand with elimination needs. Use correct procedure and equipment for transfer. Get by in shower and bedroom. Keep feet in lowest horizontal position. Barriers are used according to the care plan. Crest, cane, and waka have nasty tip. We lost on bed and wheelchair. Nasty wheeler on bed and wheelchair. Nasty football use one app. Respond properly to bed and chair and lamp. Orient patient to physical surrounding. Explain use to call bear. Assess patient risk for failing. Instruct patient and family to seek assistance when getting app. Maintain patient toileting schedule. Absorb, assess patient frequently. Encourage family position in patient. Encourage family participation in patient care. Thank you so much.
So now our topic is finished. So yeah. So Merry Christmas to everyone.